So the training program really offers robust clinical experiences across the breadth of pediatric nephrology, from dialysis to transplant to general nephrology. And the research opportunities are equally broad. Our fellows are involved in research in basic science, in translational research, and clinical research. So we feel like we offer the opportunity to train to any type of career that you might imagine in academic pediatric nephrology.
And we take care of children not only within Western Pennsylvania, but by virtue of outreach clinics and now with virtual visits far outside the boundaries of Pennsylvania. Our transplant program, for instance, sees patients from all across the United States. We've had patients from 18 states outside of Pennsylvania come to our transplant program. So it's a very robust program. The size and the breadth of the program here in our Pediatric Nephrology Division is actually quite robust, particularly given the size of the city of Pittsburgh. We have 4 faculty that are primarily clinically focused, and then we have 4 MD faculty that are primarily discovery, research focused, and an additional 2 PhDs.
From a clinical standpoint, we have a tremendous CRRT program here. Dr. Dana Furman, one of my colleagues, who's both a nephrologist and intensivist, has truly developed an incredible training and education program for the nephrology fellows and for the critical care fellows that we have the opportunity to work in collaboration with them and really provide the best care for our patients who require renal replacement therapy in the ICU.
24-hour ambulatory blood pressure monitoring is one of my passions in my professional interests. And we started a program approximately 10 years ago, and now we do about 300 to 350 studies a year. So certainly, as a fellow, you'll be exposed and also learn when it's appropriate to use it and how to use it in your clinical practice.
Another unique part of our program is the breadth of our research. It's almost unprecedented to have the high quality research in the domains of laboratory-based research as well as patient-oriented research.
Our program does an excellent job of trying to keep our finger on the pulse of the fellows and their mood, morale, and experiences so that we can make sure that we are providing the best environment and educational opportunity for them to succeed as fellows. I think one strength in particular of the program that I took away as a former trainee here myself is I felt as though any questions or concerns that I had about my training and education, I was always able to bring them to someone's attention in the fellowship leadership, and that my concerns were always listened to and addressed.
So the staff and faculty here are amazing people. They're very easy to work with, they're great colleagues, and I feel like a good part of the team.
I really enjoyed that we are a referral center for a lot of different states, and so we have a pretty large patient volume and see a lot of rare diseases.
A typical day in fellowship is going to vary from your first year to your second and third year. So your first year, you're going to spend the vast majority of your time either in the clinic or on the floors in kind of 2-week blocks. And then as a second and third year, your time is dedicated to research. So I would say I spend 75–80% of my time as the second year actually in my lab. You're here because the attendings and the staff want to be training fellows, and that's reflected in the diversity of experience that you get.
There's lots of components of this program that make it very special. One is the fantastic guidance and mentorship from the faculty. There's also an unbelievable support and benefit of having a multidisciplinary team that functions here in the nephrology division. We have social work, psychology, pharmacy, nutrition, dialysis nurses, transplant coordinators, and general nephrology nurses that are all there to help you answer any questions that you have, help support the patients that we care for. So Pittsburgh is a fantastic place. There's fantastic restaurants. If you're a foodie, there's great places to explore if you're an outdoor person, biking, hiking trails, and then the cultural aspects of Pittsburgh are fantastic. There's theater downtown, there's plenty of museums. The Heinz History Museum is one of my favorites, and then there's lots of opportunity to take part in the various festivals, including Picklesburgh and other events going on around the city.
We have many outstanding features of our program. We have outstanding education in all areas of nephrology. There are faculty within our division that have positions like this that can act as role models for you.